Foundational to the practice of medicine and also the practice of psychology and psychotherapy is trust between the doctor and the patient, or the therapist and the client. Without that, nothing can move forward. And foundational to the trust is the ability for the patient to speak openly and honestly with the doctor or the therapist about what's going on in their life. If they don't feel confident and comfortable doing so, not much can proceed. And Catherine mentioned some examples of how certain patients are not comfortable expressing things in their life to their doctors or to their therapists, and therefore their medical records are incomplete. Now, trust is diminishing both in the practice of medicine between doctors and patients, and in psychotherapy between therapists and clients. We have some statistics from Health and Human Services which confirm this. We have 2 million Americans do not seek mental health treatment due to privacy fears. Nearly 600,000 Americans do not seek early treatment for cancer due to privacy concerns. Millions of Americans do not seek testing and treatment for STDs due to privacy concerns. You're talking about a lot of Americans who are not getting the kind of treatment that they need for very dangerous diseases such as cancer. Or if you think about STDs, it can lead to major reproductive problems or even death in certain cases, specifically to HIV and AIDS. And if these patients are fearful because of their privacy concerns about expressing what's going on in their life to their doctors, you can see that the practice of medicine is diminishing, and the outcomes will diminish in terms of the outcomes for the patients in terms of improving their health. And you might ask, why? What's going on in the past many years that this trust is diminishing? And I hold in my hand one of the reasons for this lack of trust. How many of you guys here in this room have gone to see your doctor or gone to CVS for your pharmacy or clinic or hospital and gotten your privacy notice? I should say your so-called privacy notice. Everyone should have at least gotten this and signed it. How many in this room have actually read the privacy notice? Okay. Wow, that's not good. Well, the first paragraph of every notice that I've looked into always says, we value the patient's privacy and we're going to do everything we can do to protect your privacy. And most Americans go, oh, great, okay, sign it. And then you have to read the rest of it. And what's kind of really scary, and Jim could speak to this in terms of a lawsuit, is that this is not a privacy notice. What it is it's information about disclosures which this entity which you're signing for is legally allowed to offer to 3 different types of other entities: for treatment, for payment, and for healthcare operations. Treatment would be, for instance, your doctor team, nurses, doctors, and other clinical practitioners, so they can have access to your medical records. So you go to the hospital, you want the oncologist to have the records, you want the radiologist to have the records, you want the nursing team to have access to your records. And all that, to a certain extent, makes sense, because you do want your team to have access to your records. But in a more perfect world, it should be required by consent. And you should determine who amongst your team you want to have access to your records. Perhaps you want your oncologist to have certain records, you want your psychiatrist to have other records, you want your radiologist to have other records, but perhaps you don't want everyone to have all access to all your records. Unfortunately, you don't have that choice these days. The second thing beyond treatment is payment. Most people have third-party payments, whether it's government or private sector. So, the third-party payers want to have access to some information of what they're paying for, and it makes sense. They want to know what they're paying for, and what was discussed earlier, they eventually want to ration care and limit their exposure, their costs. That's also without your consent. The third thing is healthcare operations, and according to Jim Piles, who represents the American Psychiatric Association, there are over 600,000 entities here in the United States who can have access to your healthcare information as part of healthcare operations. And that too is without your consent. So that's a lot of organizations, associations, institutions, businesses, and individuals who could have access to your healthcare information without your consent. And from my point of view as a therapist and someone who promotes medical privacy, that's very, very concerning, because the decisions that those other entities can take on your behalf could be devastating to you down the road. And I'll give you an example. I had a client tell me a story where he had kidney problems, and he went to see his nephrologist. And they asked all the questions that they're supposed to ask. And they asked about previous drug use, and marijuana came up earlier. I think Catherine might have mentioned marijuana. And he said, oh yeah, in college I smoked pot a few times, no big deal. And his nephrologist wrote that in his records. And many years later, the same person went to go get long-term care insurance, and smoking marijuana happened to be in his medical records. He was denied because of previous drug use. He had used illegal drugs. Now, we're not talking about a drug abuser who's smoked pot or other drugs for dozens and dozens of years. We're talking about a handful of times in college, You can say that's stupid, that's not the smartest thing to do, but should this person be denied long-term care insurance because of a mistake or a choice that this person took 20, 30 years earlier? The answer should be no. And it's really kind of disconcerting if you think about all the information that you all tell your doctor, whether it's about reproductive issues, relationship issues with your spouse or your kids. The example was given earlier. I think Catherine gave an example. So sexual issues that you might bring up with your general practitioner, or other issues that then go into your medical records, and then you've got to wonder how many people have access to these records and what decisions are being taken either then or down the road. In this case, this gentleman could not receive long-term care insurance. And it's a problem. And part of the problem, too, in terms of reduced trust, there's a couple other things, too. Researchers have access to your healthcare information, and they claim it's de-identified. But in fact, if you talk to the experts, it's really easy to re-identify your information. So that's a whole host of other people who then have access to your information without your consent. Health oversight. You have government agencies, both state and federal, who are required to ensure compliance with HIPAA or other government laws and rules and regulations, and they would have access to your medical records to ensure that the doctor or the clinic, the hospital are complying. That's without your consent. And you might say, well, it's important that laws are followed and rules and regulations are followed, but it should always be with the consent of the patient. A stranger should not have access to your information without your consent. A third area is law enforcement. You might say, well, law enforcement, police should have access to your information. Well, I'll just give you an example, for instance, of the Patriot Act. The Patriot Act, there are two provisions, the 215 orders, also called the library provisions, and the 505 orders, the national security letters. The standards for these things are so low. One of it is relevance to a terrorism investigation. Well, I mean, anything can be considered relevant to a terrorism investigation. So the standard is so low that law enforcement can just gather these files and files of your information. And there's no way to really protect yourself, especially with 505 orders, because there's a gag order against, for the person who receives it to go tell the person whose file has been taken that they received it. And there's no judicial review. The agent in the field, or actually I think there's been a slight change, the FBI field agent can sign off on the order. There doesn't have to be a judge. So there's not even checks and balances over law enforcement. And the Department of Justice has already acknowledged that the Patriot Act is being used for non-terrorism investigations. So the standards are really low. You have to wonder what other files law enforcement are accessing, what they're using it for, how they're holding it. What information are they gathering, not even necessarily for the case, but what they're gathering for other possible cases? I think Catherine gave the example of perhaps, my son's, I don't have a son, but my son's smoking pot, it's in the medical records, law enforcement gets that and goes, well, that's interesting, let's investigate that. What protections are there for that parent, the son, to ensure that there's reasonable cause for a police investigation? And some of these things need to be looked into and are a concern to me.